When discussing the neurocutaneous disorders, we can start with neurofibromatosis type 1. The clinical presentation in the vignettes with neurofibromatosis type 1 usually include the diagnostic criteria. Frequently on the USMLEs you will find a question stem as well as an image. These are neurofibromas. Here you can see the café au lait spots. They are hyperpigmented macules. We need at least 6 of them on the question stem to consider them as a positive diagnostic criterion. You can see the leash nodules. The leash nodules are hyperpigmented spots inside the iris. The bone lesions are typical for neurofibromatosis type 1. You will frequently have a CT scan on the question stem, and you can see either a sphenoid dysplasia or you can see an anterolateral bowing of the tibia. So a CT scan can be given if the patient has an optic glioma. In regards to genetics, neurofibromatosis type 1 is an autosomal dominant disease. It is caused by a mutation on the 17th chromosome. It is a mutation in the NF1 gene, or this gene encodes for the protein neurofibromin. In regards to the management, there is no curative treatment. The choices might have an mTOR inhibitor as a correct answer. Another neurocutaneous disorder that can be seen on step 1 and step 2 is neurofibromatosis type 2. Also, here are some clinical criteria to make a diagnosis. The diagnosis criteria are bilateral vestibular schwannomas. This is usually seen with a CT scan, or we might have in the question stem the fact that the patient has a first degree relative with NF2 and also that he has some tinnitus. This indicates a unilateral vestibular schwannoma. We might find that instead of these clinical criteria, we'll have 2 of the next pathologies: meningioma, a cataract, an ependymoma, or a non-vestibular schwannoma. In step 2CK, we will be asked what is the best next step. To identify the schwannomas, frequently we will opt for MRI or CT scan. This will be followed by genetic testing. Choose the auditory testing to differentiate between a sensory neural problem, such as in the case of vestibular schwannomas, or conductive problem, such as in the case of otitis media. Step 1, a frequent question is what is the mutation seen in a patient with neurofibromatosis type 2? The mutation is a mutation of the NF2 gene on the 22nd chromosome. This gene encodes for Merlin and it is transmitted autosomally dominant. If you want to receive a weekly newsletter with summary sheets that will help you to prepare your rounds as well as the USMLE, please send a demand for this newsletter at medicalperspectiveblog@gmail.com. Another neurocutaneous disease seen in both step 1 and step 2CK is tuberous sclerosis. It has numerous clinical presentations, therefore you might have a patient that presents with angiofibromas. Also, it can show a CT scan with cortical tubers, as you can see here, the hyperintensity regions in the frontal lobe as well as the temporal and occipital lobe. Also give you an abdominal CT scan that shows an angiomyolipoma. It can also present with retinal hamartomas and you will receive a fundoscopy exam. You can be given clinical exam finding through the form of hypomelanotic macules. As you can see here on the right, on the patient's limb, there is a hypomelanotic macule. You can be given a Chagrin patch and be given a CT scan that will show a subependymal giant cell astrocytoma. This type of CT scan will show more frequently with a child in the question stem. In the case of step 1, once again you can be asked about the genetics of the disease. In the case of tuberous sclerosis is caused by 2 genes. There is a mutation in the TSC1 gene that is on the chromosome 9 and encodes for hamartin. Also, it can be a mutation on the 16th chromosome that encodes for tuberin and is represented by TSC2. Tuberous sclerosis is transmitted autosomally dominant, a rare disease seen on USMLEs, known for its nevus flammeus, a port wine stain in the territory of the trigeminal nerve. We can have a question stem with a CT scan that will show a leptomeningioma. Also, the child can present with signs of increased intracranial pressure, such as papilledema or headache. Also, he can present with seizures. Finally, the patients might have an episcleral hemangioma. Let's test our knowledge up until now with a clinical vignette. A 4-year-old that presents after a seizure at the emergency department. On history taking, he states that it hurts behind the eye. There are 4 protuberous lesions on his left arm. What is the best next step in the management of this patient? We do a CT scan of the head. B, we go for the MRI of the head. C, we do a diazepam infusion. Or D, the genetic testing of this child. Pause this video and let me know the answer in the comments before we solve this vignette together. The answer is B. The MRI has a higher sensitivity than the CT scan. There are 2 criteria for the diagnosis in this vignette. Firstly, we have an optic glioma. MRI of the head will confirm it. We have more than 2 neurofibromas. If you like this type of content and would like to see more USMLE related content, hit the subscribe button.